Welcome to the NAHA webinar brought to you by the National Association for Holistic Aromatherapy. To learn more about NAHA, please visit www.naha.org. Tonight's presentation topic is essential oils for nausea and vomiting. This educational webinar is being presented by Jessie Hawkins. Jessie is a natural health scientific researcher, and she's also the director of the Franklin Institute of Wellness. She is the NAHA Regional Director for the state of Tennessee. Jessie combines her expertise as an aromatherapist and herbalist with her scientific training to conduct clinical trials and other scientific studies on the healing benefits of essential oils. Jessie has a PhD in health and holds a bachelor's degree in environmental health, a master's degree in health promotion, and has additional postgraduate education in the field of epidemiology. In addition to holding numerous certifications in a range of natural health fields, including aromatherapy, aromatic medicine, herbalism, childbirth education, labor support, and more, she also travels regularly to conferences and workshops to ensure that her programs provide the most current and up-to-date information available. To learn more about Jessie, please visit her website at www.franklininstituteofwellness.com. And I'd like to take a moment and welcome Jessie for being here this evening. We appreciate you presenting.
Thank you so much for having me, Kelly. It's always an honor to be here and to talk about essential oils and research, which of course are my two favorite things. So
Good. We're
really
glad you're here. Thank you.
Yeah.
So you could go ahead and get started. Yeah.
Okay, perfect. All right. Well, tonight we're going to be talking about essential oils, specifically as they pertain to nausea and even a little bit of nausea and vomiting kind of combined together. Kelly's already introduced me to all of you, so I'll kind of skim through this part here. But I do want to, before I dive directly into it, if you've participated in any workshops that I've given before, whether at the Institute or here at NAHA, you know that one of the things I usually do is really try and integrate in my aromatherapy and aromatic medicine education with the research. So we'll frequently address a topic or address a subject, and I usually kind of start with some sort of health research principle or methodology or some epidemiological principle, and then weave that through how we use that to answer questions in aromatherapy or herbalism or whatever the field might be. But I want to take a slightly different approach tonight and dig a little bit deeper specifically on a single topic in the scientific literature. And of course, that topic is nausea and vomiting. So what I want to do is actually walk with you through a couple of different studies using different essential oils to solve this problem and a couple of different applications and methods, and look at kind of the overall state of science on essential oils for nausea and vomiting, the diversity of research that's available on this subject, the variety and quality of research that's available on this subject, and then talk about what still needs to be done. And at the very end, I'm even going to talk about a way that you can get involved with research on this particular subject. So we're going to kind of just dive right into the scientific literature and dive really deep into the subject, looking at some of the specifics of these studies. And I've also included some practical application tips that you can use, because I know that one of the key takeaways for these studies is how can we replicate that? How can I make that happen in my home or in my practice with my clients or patients or family or whatever that might look like for you? So I've got that kind of worked in there as well. But before we dive directly into the research, I do always like to kind of set a little bit of framework and make sure that we're speaking the same language, defining terms the same way. I found that when we go through some of these workshops, it's very easy to miscommunicate if I'm coming at a topic with a certain understanding of the term and you're coming at it with a different understanding. And since there's quite a few of us here tonight, then there's a lot of room for different perspectives. And so I like to just clarify some of these basics, not because I think you don't know what nausea is, I know that you do, but just to kind of give a little bit of perspective as to where I'm coming from so that you can really get the most out of the rest of the evening. So nausea, of course, is that feeling that reflects that urge to vomit. We start to feel nauseated when we think that we may vomit. It's kind of that feeling that's coming on. And then, of course, when that actually materializes, then we vomit. And so as a result of that relationship there, then in the scientific research, we actually tend to measure those using the same measurement instrument. So anytime we talk about nausea, we're typically going to also see research that talks about vomiting. And we'll usually see that we're measuring both of those things at the same time. Because one thing that we found is that if we can reduce the feelings of nausea, then we also typically reduce the total number of vomiting episodes. So while nausea is kind of the focus of the evening, you're going to see vomiting crop up, and that's why we're going to be talking about it so frequently. Another important caveat I like to remind ourselves of every time we run into this is that nausea in and of itself is not typically the disease. It's a symptom usually of some kind of underlying condition. Now, it could be a health condition, or the condition could just be that this vehicle is moving and we're trying to read a book while sitting in the back seat or something. But when we're going at something with this holistic perspective, this holistic approach, then we do want to address those symptoms. Of course, we want to feel better, and we might use our essential oils or our herbs or our supplements or whatever tools we have in our holistic toolkit to address those symptoms so that we feel better. But we also want to address that underlying condition as well, which first will, of course, require identifying whatever that underlying condition is. So for the purpose of tonight, the research that I talked to you about is going to be focused on that symptom, the feeling of nausea and vomiting, not necessarily all of the underlying conditions. That would be, we could spend days even going through all of the different ways we can use essential oils to address those underlying conditions. So when you identify an underlying condition for something in your practice or in your home, you might be also using other essential oils that we're not talking about tonight, because you might be addressing the symptoms with some of the oils that we discussed tonight, but then you might also be addressing some of those underlying conditions with a completely different protocol or a completely different set of oils. And so it's important sometimes to kind of separate those two concepts and look at them as, treating the symptoms and treating the underlying condition. And so keep in mind that there are going to still be some really effective and useful tools that we don't discuss tonight because we're kind of parsing those two out. Some of the more common causes of nausea and vomiting, some of these are things where identifying that underlying symptom is pretty easy. Motion sickness in a car or in an airplane, for example, or morning sickness in a pregnancy. Obviously, we don't want to necessarily alleviate any of those underlying conditions. We just need to get through it. If it's air sickness, then treating the underlying condition is arriving at our destination. But some of these other conditions, concussion or brain injury, for example, or ingestion of environmental toxins or toxicants, food poisoning, they're going to have those additional botanicals or essential oils, or sometimes even a pharmaceutical or a treatment if that's what's needed to help maintain health, overall health. That doesn't mean that the essential oils we discussed tonight still cannot be used. We're going to look at some really non-invasive ways of using these oils. But there's, again, a wide variety of causes here. There's also the potential that nausea and vomiting is the side effect of medication. We tend to think of, chemotherapy and really serious conditions or a surgical procedure as causing that. But it could also be a botanical preparation. One that we see pretty frequently in the fall and in the winter is homemade elderberry syrup. If it wasn't prepared correctly, those uncooked elderberries often have the potential to cause nausea and vomiting, or an overdose. In fact, when we're talking about certain medications, especially if we're talking about botanical medications, then that's actually one of the body's responses, is to actually kind of purge that from the body. We've gotten too much of that substance in the body, and we need to actually purge it out of the body. And so it's also important to keep in mind that sometimes, in rare situations, vomiting can actually be beneficial. Now, if this were, 150, 200 years ago, there actually was a trend in medicine where purging the body was one of the cornerstones of medicine. We had leeches, and we would give laxatives, and we would give botanicals that cause people to vomit. And that was actually a pretty common practice, both in mainstream medicine, if you went to a conventional doctor at the time, and it was also a tool that was used pretty frequently by the snake oil peddlers who were going through the street. And one of the reasons that it was so popular is that it gave some sort of physical response. We now understand that, causing someone to vomit or causing diarrhea or leeches are not typically the best necessary approach, especially when we start looking at dehydration and some of these other concerns. But I do like to point out that sometimes, in rare occasions, but sometimes, then it's actually beneficial to get something out of the body. If a child has consumed something that they shouldn't have, then that can actually be beneficial. But it's a very fine line, and I do always like to point out that if a serious case is suspected, then urgent medical care is necessary, especially when we're looking at small children, and especially when we're looking at side effects such as dehydration, if there's actually vomiting that's accompanying the nausea. And then the final caveat that I like to give before we dive into the scientific research and the studies we're going to look at tonight would be that especially if you're in your own home and you have children, or if you work a lot with children, you have a lot of children in your aromatherapy practice, or if you're a care provider with your patients, then it is important to keep in mind as well that sometimes when we're identifying that underlying cause, vomiting and feelings of nausea are symptoms that might exist in a disease when a child is experiencing that disease that don't typically occur when an adult has a disease. And so this can be another really common area of confusion, especially when we get into the fall and winter months with those upper respiratory infections that we see so frequently, is that the whole family can have the same condition, but it will cause vomiting or nausea in a child, and we don't necessarily see that in an adult. So it doesn't necessarily mean that they have, the flu plus something else, or, that they have some other condition as well. It can just be something that happens. Part of that is because we have more mature bodily systems than they have. We're, fully developed and fully grown. There are a lot of different reasons for that to take place, but that's another important thing to keep in mind, is that sometimes that underlying condition can be something quite simple that the rest of the family has as well. So with those pointers and clarifications and caveats out of the way, let's take a deep dive into the scientific literature and see what we have in terms of research on this topic, how we can replicate this in our homes, and again, where we're going from here, where we're moving on in the future with this research. So the first essential oil I'm going to talk to you about, it's actually a very inexpensive oil, a very easy to find oil, and that's lemon essential oil. Another thing I love about this oil is that there are very few people that don't like the aroma of lemon. And when we talk about using aromatherapy for really any health condition, when we start talking about our essential oils, aromatherapy, of course, is a very unique type of treatment, in that not only do we need to see how these chemicals are responding in the body, just like we do with pharmaceuticals, just like we do with herbs, just like we do with our food even. With essential oils, it's also important to make sure that whoever is using the oil and whatever application they choose or would be appropriate for the situation also enjoys the scent. There are a few applications where we can get away with saying, it really doesn't matter what it smells like because we're using it medicinally. But if we're talking about nausea and vomiting, it's really important that people like the aroma. It's especially important that whatever essential oil combination we use does not increase those feelings. And lemon is a great oil for that. It's a fresh, vibrant aroma. It's great for using in cleaning products around the house after somebody has had, episodes of food poisoning or something like that. I always love using it in a bathroom cleaner, especially when my kids were younger and would, get the different bugs that went around playgroup or school or whatever that was more frequently. Great way to really, brighten up the bathroom. But according to the scientific literature, it's also a really great way to address nausea and vomiting as well. So the study I'm going to talk to you about is the citations right here in front of you. It's the effect of lemon inhalation aromatherapy on nausea and vomiting of pregnancy. So in other words, we're talking about morning sickness. This is a double-blinded, randomized, and controlled clinical trial. And it was published in the Iranian Red Crescent Medical Journal. Now, just a tip, when I look at scientific research, one of the first things I do is look at what journal something is published in. This will tell me a lot about the quality of research. It'll tell me if it's a pay-for-play journal or if it's, a journal that's a little bit more strict with its criteria. And anytime I see a journal where it's published in a country that English is not the native tongue and English is not necessarily spoken, but the article is in English, then it is important to pay close attention to that translation. There are some articles in the scientific literature where things have been lost in translation. And unfortunately, sometimes what's lost in translation or when someone's writing in something that's not necessarily their best language is that we can actually miss key points, or we can even get incorrect information where that can't actually be what they were talking about. For example, another study that I was looking at from the same journal that was talking about and another condition of pregnancy, they actually said that the women in the study were aged 45 through 80, and that the average age was somewhere in the 60s. And those are not normal ages for pregnancy. So something was clearly lost in translation with that. So I always like to look a little bit closer when I see certain journals that the authors are written in. So one of the first things I do for this journal is go through and look at where the researchers, the authors of this paper, are affiliated. And in this particular case, they're actually associated with Tabriz University Medical Sciences. The first two authors of this study work in the Department of Midwifery, and then the final author, who's usually the advisor, works in the pharmaceutical studies. And so that's helpful and promising as well. So then getting into the details of the study, I was actually really happy with this one, and I actually wanted to start with this one because it's one of the better studies that we're actually going to be looking at tonight. There were 100 participants in this study, and they did do what's called a power analysis that tells us how many people we need in a study, and this was more than enough people for that study. It was a short study. It only went for 4 days, and I really like that about this study because when we're talking about morning sickness, we don't necessarily have the benefit of time. Sometimes with herbs or essential oils, things are highly effective after you use them for a couple of weeks or even a couple of months. We actually just wrapped up a clinical trial on using essential oils for fatigue among women who had hypothyroidism. And what we found is it really took 2 weeks to see the aromatherapy group really break away from the placebo group and really see some beneficial effects here. So this 4-day duration is going to tell us, what it's going to do immediately for these women, which is important because those early stages of pregnancy, they're so short and you really need relief pretty quickly. The next thing I like to look at if I'm looking at a study is the measurement instrument. This is really important because this is how we tell what we're measuring, how we make sure that we're measuring what it is that we think we're measuring. And so the measurement instrument here is looking at overall nausea and vomiting, and it even has some quality of life questions. And it's meant to measure a 24-hour period, which again is perfect because that's what we want to see for this intervention is what are the immediate effects of this exposure. The next thing you want to always make sure you look for when you're looking at a study is the application, because this is how you're going to replicate the study. There are so many times that we'll look at a study and say, this study said lemon oil works for this. And then kind of mentally, we take some shortcuts in our takeaway and we decide that the takeaway actually means, we can use that oil in any application, in any exposure, any dose, any duration, and expect those results. But if we really want to see these results, we have to use the same application. So what they did here was they took 2 drops of the substance, so whether it was the essential oil or whether it was the water, and they put it on just a plain cotton ball. So nothing fancy, no expensive equipment, very easy to replicate. And they held it within 3 centimeters of the nose, and they took 3 deep breaths. And they did that every time they felt feelings of nausea. And if they needed to, then they repeated it again in 5 minutes. And then the analysis they used here is called repeated measures ANOVA, which is not necessarily the best analysis for this type of study, but it's a pretty good one. It's something we definitely would be happy with seeing. So what did they find? Well, you may have seen this study before, and you know that they found some significant effects, but I really like to look at the entirety of the effects and kind of visually take in what you see here on that screen in front of you. So the instrument they used, and one of the reasons I bring up the measurement instrument, is because we can also learn from that how to tell how bad their nausea was at the beginning of the study. So this particular tool that we use to measure nausea, 3 is the lowest you can score on it. So if you get a 3, then you feel just fine. You don't have any feelings of nausea. And 21 is the highest you can score. So that would be, really serious concerns. You'd probably be going into your care provider, even to the hospital at that point. And then the way that we measure it from here is a 6 or lower is considered very mild nausea. And then a 7 through 12 is moderate, and a 13 or higher is severe. So these women, even though they were pregnant and in their first trimester, none of them really had severe nausea. In fact, they were really just barely out of the mild nausea range. And that's important because if you're one of those women who in your first trimester, your nausea would be up here, a 16 or a 17 on this scale, then that means that we're going to have to kind of take that into consideration when we apply this and when we come up with our expectations of this oil. So you can see how right off the bat, even in the first day, the lemon group had a little bit of a drop, and then they had a consistent drop, where the placebo group was kind of all over the map. They had some good days and they had some bad days, and kind of ended up everywhere. The way that we tell whether or not these results are just a fluke, a random thing that happened to this group, or if we can expect these results to take place outside of this group, is through a p-value. It's the probability that this was a fluke versus that this was a, something that's legitimately due to this lemon. And so what that tells us, if we go through these two groups, is that here on day 2, and then again on day 4, we actually saw significant results. So on days 1 and 3, we actually didn't. So what that means in terms of takeaway is that if we want to use lemon on an as-needed basis, just for inhalation when we have feelings of nausea, especially if it's from morning sickness, that's going to be beneficial, but it might take a couple of days to really see some beneficial effects. And then we might actually see a little bit of variation in those effects. Some other applications you can use if you want to replicate this at home, and lemon essential oil has been used in a lot of different studies for nausea from a lot of different types of sources. So this one was for morning sickness, but we could also apply this for motion sickness and other types of sickness, especially if they tend to be a little bit more chronic in nature versus something that's acute, like a food poisoning or something like that. The cotton ball is a great way to do that, but if you do have access to tools, a personal inhaler would be a lot more convenient for toting around during the day, especially if you're pregnant. You could pop it into your pocket or into your purse and keep that with you, and that's a great way to make sure you have it, on demand without having to fumble with a bottle and figure all of that out while you already don't feel good and you might already be taking care of other kids as well. And then, of course, I do want to point out, because these groups had mild to moderate nausea at the beginning, then generalizability, which is, again, how we apply it to people outside of those groups, for women with more severe nausea and vomiting is going to be a little bit limited. So what that means is if you have really severe morning sickness, or if you have really severe nausea, or again, any acute type of nausea, this would certainly be, presumably useful, but you might also want to look at some other tools that you're adding as well. One other thing I do want to point out with that chart before we move on is that if you look at the entire reduction in score, you do see that it was going down. But again, it started out very low and they didn't plummet down to 3. So what that means practically is that when we measure something in a scientific study and say, yes, this is effective, that doesn't mean that it means, yes, this goes away. So the women who were inhaling the lemon, they had results. This was effective for them. Doesn't mean that every single feeling of nausea went away. It means that they were better off than they would have been if they did not use the lemon. So what that means, again, practically, just for application, is that this is a great tool to have, but you might also want to integrate some other tools in there as well. One of those tools might be peppermint essential oil. Peppermint is one of the kind of classic oils we think of when we think nausea and vomiting. We also tend to think of peppermint when we think about fatigue or when we think about headaches as well. The combination of uses with peppermint and headaches and peppermint with nausea and vomiting actually makes it a kind of a great tool for nausea and vomiting, because sometimes if you're really sick, then you can also kind of have a pounding head that goes along with it. And so there are double benefits we can get from that oil. So the study that we're looking at here was published in 2012, and it's looking at the use of peppermint aromatherapy for women who have just had a C-section. So there's a lot of research on the use of non-invasive tools such as essential oils when we're looking at nausea and vomiting that's caused by a surgical procedure, especially when we talk about surgical procedures such as a C-section, where we're really getting in there with the digestive tract, really up close and personal with that. Then as you know, we're recovering from all of that, it's very easy to feel nauseated and to experience vomiting. So if we can use something such as peppermint to help with that, then that obviously is a fantastic tool. So for this particular study, again, they're looking at post-operative nausea and vomiting, specifically from a C-section. They had a group of 35 participants, which might seem like a smaller group, but the researchers, again, conducted a power analysis and found that this was actually a sufficient number for this particular measurement. And the duration here was a single exposure. And so this is kind of a unique study, and it's an interesting one to follow that lemon study. So here they're not looking at using it as needed. They're looking at just a single exposure. And they actually took the babies from the moms to give them this exposure. And then the measurement that they used here was an adaptation of a validated nausea scale. So it was kind of a scale that the people who conducted this study kind of made up a little bit. So that's a little bit of an issue with this study. And then the way that they used this was they actually had a cotton ball, and they used a syringe of either peppermint oil, or their placebo was actually a green tinted saline substance that they would inject into the cotton ball so that it gave a green color. And then they held them up to the nose and they took 3 deep breaths. Now the analysis here, they used descriptive statistics rather than analytical statistics. And then they did a non-parametric test known as Fisher's exact test. And I'll kind of come back to that part a little bit later and bring up why I'm actually pointing that out. But applications here, you'll notice I kind of skipped right over the graph to go here. Applications here, this study used personal inhalation of peppermint oil. I do want to point out that in that syringe, they also had a combination of rubbing alcohol in there, because that's another thing commonly used in an operating room to help with nausea and vomiting. So they mixed the two together. It wasn't pure peppermint oil. And they contrasted that again with that green placebo. Now this study has some significant quality issues, so generalizability is more difficult. The statistical analysis here was not the way that we would want to analyze that, so it's difficult for me to say with certainty, you know, this was beneficial, this was not beneficial. But one thing that was pretty consistent across the board is that the people who used the essential oil enjoyed using the essential oil. And for some of the comparisons, there were some differences in how they felt afterwards. Now, peppermint essential oil, if that seems like a bizarre study to you, it is a little bit. There's another bizarre study about peppermint essential oil that was also conducted in 2012. And this one was for morning sickness. And it has kind of similarly ambiguous results at the end of it. This study was looking at putting peppermint essential oil, and it was just peppermint essential oil this time, in a bowl of water under the bed of pregnant women at night. So as they slept, they would get some of those peppermint vapors, depending upon how thick their mattress was, I guess. And then it measured their nausea and vomiting again the next morning. That particular one found that it was no different than placebo, which is probably not surprising because we use essential oils pretty frequently around here, obviously, and I imagine you do as well. And dropping them in a bucket of water and putting them under my bed has never been a way that I've used essential oils. I've used them in a lot of different ways, but that's not an application that's pretty common in aromatherapy that we might use. So with that, we'll shift on to another study looking at peppermint essential oil, a little bit of a better study than those two that we were looking at. So this one's for postoperative nausea in patients who were undergoing cardiac surgery. So here we also have a study with 34 patients that were participating, and they actually inhaled the oil pretty frequently with an inhaler. It was a personal inhaler, so this time they're actually using an aromatherapy application, and they inhaled it for about 2 hours. And the instrument they used, or the way they measured nausea here, was through the visual analog scale. So this is something you can actually replicate at home. It's kind of like if you've ever been to an emergency room and they say, what's your pain on a scale of 1 to 10? This one is asking about your nausea on a similar scale. And then they just paired the samples together. Instead of using more advanced statistical techniques, they just paired them together and compared them. And so here's what they found. The nausea scores, as you can see, were dropping quite a bit. Again, the scale here is from 0 to 5. So they actually had a pretty fair amount of nausea at the beginning of this, unlike that lemon one where we saw previously. And you see a pretty good drop here towards the end, going down to just over 1. So these are much more significant effects in terms of the result or the impact that we can actually expect to see. So when we want to replicate this at home, that personal inhalation device that they used is a great way to do it. So whatever tools you use at home to take your essential oils with you, if you have little aroma sticks or little personal inhalers or little scent sticks, whatever that might be, that's a great way to carry them with you and to replicate these results if you need to. It's also a really great way to use essential oils for situations like this, where we're looking at, a hospital room, or if you're trying to use them on an airplane, for example, where there are a lot of people around you. Those personal inhalation devices enable you to benefit from the essential oil without having to worry about exposing everyone around you to the essential oil. So that's a really great tool to use as well, especially if it's for travel sickness or for anything along those lines. So the next one we're going to talk about is ginger essential oil. And usually when we think nausea or vomiting, especially in the herbal and aromatherapy world, ginger is kind of our go-to. But when we dig into the scientific literature, we find that there are a lot more studies on the herbal extract than the essential oil. And one of the reasons for that is that a lot of the chemicals that we know are associated with the effects of ginger on nausea and vomiting are too heavy to be extracted in the distillation process. But we are able to extract them in the CO2 extract. So if you've been toying around with CO2s, that's a great way to get a hold of those. And of course, in these herbal extracts or herbal capsules as well. But while a lot of emphasis has been placed on those heavier molecules, there are molecules in the essential oil that we know help with nausea and vomiting. And the reason we know that is because we have scientific research that shows us that. So here's an example of, again, post-operative nausea and vomiting using ginger essential oil that we have here. So in this particular study, what we had is we had the ginger and the placebo that were applied. And one of the things that they did here was they actually were using a vomiting score. So these numbers that you see here on the side are total numbers of vomiting episodes that they used. And they used an inhaler stick to achieve this, and they used it in a very small dose for a prolonged period of time, kind of like that peppermint study that we just looked at. And you can see here how in the ginger group, they were a little bit lower to begin with, but they plummeted all the way down here after recovery. And another thing I want to point out is that this first measurement is they were already having some ginger exposure. So you see that all the way across the board, they did a lot better with the ginger. Now, in the nausea scale for this particular study, the chart for that one actually shows a little bit of a rebound effect. So for the overall nausea scale, it dropped down while they were exposed to the ginger. And then when the ginger was removed, then it rebounded. And then feelings of nausea actually got worse. So the takeaway for that would be, again, with the personal inhalers, these seem to be the best way to apply essential oils if we're looking at addressing nausea and vomiting. If you really want to boost efficacy, and if you have your hands on some really good CO2 extracts, then you could use that instead of the essential oil. You could place that in a personal inhaler or in another formulation that you might be using. And then because the nausea exposure actually had that rebound effect, then we would want to look at that, again, prolonged low-dose exposure, and we would want to probably continue that until symptoms have resolved. So unlike some of the, like the lemon oil that we talked about, where we see a pretty sustained effect, we actually see this one rebound a little bit. There was another study conducted in 2015 on ginger essential oil that had almost the same type of findings. This one was for chemotherapy-induced nausea and vomiting. And they found that the oil had a significant reduction at the very beginning, and then after time that it rebounded. So again, there seems to be this trend with ginger where we get some really good immediate effects and then it kind of bounces back. But one thing that tells me is if we were to look at combining some of these effects, then we could actually see that lemon oil that did not give us that really quick, immediate result would be a great solution here. Ginger's going to give us those quick, immediate effects, and that lemon seems to give us more of that prolonged effect, and we can use it for a prolonged period of time without having to worry quite as much about the aroma. So that's a great way to kind of combine this research and get the best of both worlds. And speaking of blends, researchers have also looked at using some blends to achieve these effects and looked at, what if we were to take it and mix it all together? So in this particular study from 2016, they're looking again at postoperative nausea and vomiting, this time in children. And the blend here was a 1-to-1 to 1-to-1 formulation. So a personal inhaler, equal parts of everything across the board. They used lavender, spearmint, peppermint, and ginger. So the spearmint really helps to tone down that peppermint quite a bit. And then they put lavender in that particular formulation instead of a citrus oil. So when we look at the effects of this blend kind of all mixed together, they had 39 people and they looked at a 15-minute interval. And this one had the Baxter retching scale, which is actually kind of referred to as the BARF scale, is the way that they tend to refer to it. That's why we've got the retching faces in the middle of it. And they looked at using this post-operatively every 15 minutes until either the child was discharged from the hospital or until the symptoms went away through the personal inhaler. And then the exposure duration was at the preference of the patient. So they didn't actually have, specific exposures that they were using. They basically just called it an exposure if there were 5 respiratory cycles. So they would breathe it in for, 5 breaths and then choose whenever they wanted it. So you'll notice there's a little bit of difference here in terms of the way that they used this particular blend as compared to some of our previous studies. And then again, they did t-tests, which is not the best way to analyze a study like this, especially not the way that they did it here. So that's why, again, these results are going to be a little bit different than the ones that you've seen previously. But what you can see here is the takeaway is that when we look over here for that p-value, which tells us if something was actually effective, then we see that the only thing that was actually noteworthy, the only difference in the two groups, was this continued use of intervention. The people who had the aromatherapy blend wanted to keep using it. The people who did not want to keep using it. But otherwise, there really wasn't much of a difference between the two groups in the total number of times that they vomited or their scores on that particular scale. And so sometimes when we put oils together, I know we like to talk about our blends, and we usually like to, blend as though every single time we mix essential oils, we're going to get a better product from the end. But sometimes when we put our essential oils together, we don't end up with a better product. We really don't know what we're going to end up with. And so I like to always kind of come back to this. When we think about the scientific method, we usually think about, picking something that we really like and then going out there and showing that it works. But in real life, research is not nearly as fascinating or exciting. In real life, the vast majority of research that we do, it can be really mundane, and this is actually what happens more often than not. So you've got your researcher here who's thinking about what's in the literature and thinks up a hypothesis. And you can see the researcher starts to smile, which is almost always a bad sign. Something's going to happen. So they conduct their research and they get their data, and their data come in and say, no, nope, wrong, didn't work. And you see the sad researcher there at the end. And then basically you can just kind of circle back around. And it's a sad story. It's also a very common story, but it's also a very important story, because going through scientific data and going through all of these different people who volunteer for all of these different studies and really seeing what works across the board for the most people, what can we really be certain is going to help our children or our clients or our loved ones, then that's actually what separates science from pseudoscience, is that we're willing to kind of go back and look, and we're willing to kind of take that no sometimes when data gives us that no. So in this particular example, then mixing lavender in with those oils didn't appear to be the best approach. What we actually see is some really good benefits from those single oils. If we're looking at just one or two single oils for nausea and vomiting. What we don't see in the scientific literature, though, is a study that compares all of those single oils to each other. And we don't see using other essential oils. We saw that blend integrated some spearmint and some lavender. But what about other essential oils? What if we kind of branch off from just the lemon and the peppermint and the ginger? And so because we here at the Franklin Institute of Wellness have a research team, then when we see that there's a gap in scientific knowledge like that, we want to fill it. That's us right there at the top of the page, doing the thinking and then doing the smiling to see, can we fill this gap? Can we learn something? And so we actually have a clinical trial that's underway right now, and we're recruiting participants for this study. So I can't show you the fun graphs and the charts and all of the findings of the study just yet, but I can tell you a little bit about it and where we're headed. So we're currently recruiting for this particular study. And the way that we're going to conduct this particular clinical trial is we're looking at pregnant women. We're looking at morning sickness, because you'll notice a lot of the research was on postoperative nausea and vomiting. But really, it's pregnant women who really need to know how can we address this chronic nausea and vomiting, because that's a question that we have, especially for something that's non-invasive like aromatherapy, where this is not like motion sickness. You know, if you get sick on your plane, it's going to land within a couple of hours and you're going to be able to get off the plane and you're going to feel better. If you have food poisoning, it's going to pass. But if you're pregnant, it might last for a while. It might stick around for a few weeks. So this was a really important area where there's not enough research on this particular subject. And so we're looking at women ages 18 to 45 who are in that early stage of pregnancy. So they've got a confirmed pregnancy, but they are less than 10 weeks or 10 weeks at enrollment, because the study has got to finish before they get out of the first trimester, and it's a week-long study. We're also doing 6 days because there aren't any morning sickness studies looking at prolonged effects of these essential oils. So we want to see, you know, if we go beyond that 4 days, if we go into 6 days, and we're looking at daily exposure and daily data collection. So when I come back to you and we have results from this, I'll be able to show you really specific details with several different essential oils that we're using compared to a control group, and looking at how they bounce around and if they can persist over the 6 days or if they rebound like we've seen. A couple of legal things I'm required to tell you is the study has undergone ethical approval, which means that an ethics committee has looked at it and approved that we can do this, and there's that approval ID there. It is registered as well with clinicaltrials.gov. There's the identifier information, and that's a recognized registration agent with the World Health Organization, and legally all clinical trials have to be registered that way. And also it's fully funded by the Franklin Institute of Wellness. So we don't accept any money or any funds from any essential oil company, so that we can say that we have no conflicts of interest to declare. So no consulting fees, no formulations or blending for any companies, no sale of essential oils or you know, affiliate sales or anything like that conducted. So it's fully self-funded without any of that. And we'll be recruiting through the end of 2018. So I do look forward to coming back in a year or so and sharing those findings with you, so that we can have some more information here that gives us a little bit more to our conclusion. But as it stands, the state of the science right now, what we know is that essential oil inhalation is a useful tool for reducing total scores of nausea and vomiting episodes. So we don't see it necessarily making it go away every single time, but we do see a pretty consistent trend, especially when we look at what we know so far is lemon and ginger and peppermint just by themselves tend to be really great tools for this. Nothing fancy. You notice nobody had any expensive preparations or equipment that they needed, just basic inhalation of those oils. Again, I do like to point out, though, that reduction is not the same thing as completely alleviating nausea. And so as a result, the fact that this inhalation is something that's non-invasive and can be combined with other treatments means that if you have more severe nausea and vomiting, you can still use your essential oils. You just might want to combine them with another tool or another treatment so that you can really start to duplicate those effects and really get your scores down to where you need to have those scores. So there's kind of the overall summary of what we have in the literature and where we're going from here. And then Kelly, are you here?
I'm here.
There you are.
Yeah, so you finished your presentation, and then that's the contact information so that, if anybody wanted to get in touch with you. So thank you so much for your wonderful talk tonight. We really appreciate it. I'm going to stop the recording.